In the intricate landscape of healthcare, hospitals are entrusted with the responsibility of providing safe and competent care to patients. Hospitals can be held liable for injuries and damages under various circumstances. The foundation of any lawsuit against a hospital typically rests on proving negligence, which involves demonstrating that the hospital failed to meet the standard of care owed to the patient. Key areas where hospital liability can arise include 1. Medical malpractice by hospital staff. Doctors and surgeons. While many doctors are independent contractors, some are hospital employees. If a hospital-employed doctor or surgeon commits medical malpractice, the hospital can be held liable. Nurses and technicians. Mistakes made by nurses, technicians, and other medical staff who are hospital employees can also lead to hospital liability. 2. Administrative and operational failures. Inadequate staffing. Hospitals must ensure adequate staffing levels to provide proper care. Understaffing can lead to medical errors and patient injuries. Poor training and supervision. Hospitals are responsible for training and supervising their staff. Failure to do so can result in negligence. Inadequate facilities and equipment. Hospitals must maintain their facilities and equipment. Malfunctioning equipment or unsanitary conditions can cause patient harm. 3. Vicarious liability. Hospitals can be held liable for the actions of their employees under the legal doctrine of respondit superior, meaning let the master answer. This doctrine holds employers responsible for the actions of their employees performed within the scope of their employment. To successfully sue a hospital, certain elements must be established. These include 1. Duty of care. The hospital must owe a duty of care to the patient. This duty arises when a patient is admitted to the hospital for treatment. 2. Breach of duty. The hospital must have breached its duty of care. This can occur through acts of negligence, such as failing to maintain sanitary conditions, or through omissions, like not providing adequate staffing. 3. Causation. There must be a direct link between the hospital's breach of duty and the patient's injury. This means proving that the hospital's negligence caused or significantly contributed to the harm. 4. Damages. The patient must have suffered actual harm or damages as a result of the hospital's negligence. Damages can include physical injury, emotional distress, additional medical expenses, and lost wages. To better understand when you can sue a hospital, let's look at some common examples of hospital negligence. 1. Surgical errors. Performing surgery on the wrong site, leaving surgical instruments inside the body, or causing unnecessary damage to organs or tissues. 2. Misdiagnosis or delayed diagnosis. Failing to correctly diagnose a condition or delaying diagnosis, leading to worsened health outcomes. 3. Medication errors. Administering the wrong medication or incorrect dosage, or failing to recognize harmful drug interactions. 4. Birth injuries. Negligence during labor and delivery that results in injury to the mother or child, such as improper use of delivery instruments. 5. Hospital-acquired infections. Failing to maintain sterile environments, leading to infections that patients acquire while in the hospital.